Now on the line, friend of the show, chief epidemiologist from Michigan State University public health expert, Dr. Deborah Verholden. Dr. Verholden, you there?
I'm here, Attorney Patel. How you doing? How you doing?
I'm doing well. Dr. Umar, are you still there?
Yes, sir.
All right, thank you so much. So I'm glad that both of you are here because I want to make sure we present the audience with both sides of this discussion on the vaccine.
Yeah, and we're saying the vaccine. I want to be real clear. In the U.S., we've got 3 currently available FDA-approved, different regulatory levels, vaccines that are on the market. So I'm talking specifically about the 3 that are in use here. Those vaccines have been proven safe and effective. The side effects and the very rare but important negative effects that have been shown in a very small number of people are known. The signs and signals, if you are having a negative or an adverse reaction, are known and are manageable and can be treated. So that is the current state of the science. The vaccines have been proven to be safe and effective at reducing the risk of transmission, most importantly, at the risk of, it's not 100%, but it does reduce the risk of transmission. It reduces symptoms, it reduces severe symptoms, the need for hospitalization, and the risk of death. That is what we know, and it's the state of the science.
Of course, I wouldn't impugn the doctor's professional opinion, but I would ask, how can she be certain that these 3 vaccinations have been proven safe? Are we just parroting the conversation that's coming from the Food and Drug Administration, or have we looked at it in-depthly to see whether or not we concur with the narrative that they have been proven safe? And if so, how do you explain so many deaths from fully vaccinated individuals?
Oh, that's a great question. That's a great question. And so, no, I'm not parroting what the FDA says. I do trust what's come out of the FDA because many of the people that are in our circles, we know, are also looking at this data. We have our very own COVID task force through the National Medical Association, the largest and oldest association of Black physicians in the world. Dr. Leon McDougall, the outgoing president of NMA, reviewed that data. He participated with the White House task force. And he said, and a panel of doctors that we chose who got to review that same data and are ongoingly looking at that data, have said that the vaccine is safe and effective for us and will absolutely provide more good than harm to us. So if I don't trust the FDA, I definitely trust the National Medical Association and the brothers and sisters in that organization who've done the work and who've looked at the data. And I also trust the data that I've looked at myself. I have a very deep dive in my own state. I'm on the Michigan Coronavirus Task Force, the Flint and Genesee County Task Force, and the New York City Task Force. And I've gotten to see data from other places. So it's unfortunate the vaccine is not 100%. It's not the panacea. It's not going to solve this problem of COVID, and we now have to learn to live with it. But I don't think the vaccine has caused those deaths. What it did is it failed at preventing them. And that's tragic, but that it's not 100%.
And I
how
think
do you explain, good doctor?
Go ahead, Dr. Johnson. Keep this going.
So many people being vaccinated and still catching the coronavirus. If the purpose of the immunization is to reduce the risk of catching corona, why do we still have so many fully vaccinated individuals still coming down with the infection?
Yeah, what we learned in the clinical trials was efficacy, how well the vaccine worked under ideal conditions. And from when those vaccines were developed till now, this is a new strand of the coronavirus. SARS-CoV-2, the virus that causes COVID-19, is new to us. That virus is now mutated. And what we're finding out is the currently available vaccines are not as effective in the face of these variants as they were in the clinical trials. And so what's predictable is very similar to the flu vaccine. It's going to be seasonal. And we're going to have to keep pace and have a vaccine that keeps pace with the most dominant variant strains and the strains that seem to be more highly transmissible. This is how this works. This is not new for us. It's the same thing with flu. So, unfortunately, we rolled out the vaccine too slowly and, in my opinion, removed other important layers of protection. And now the vaccine is not operating and optimally providing the protection that we had hoped it would provide. I will tell you, though, however, from the data that I'm personally collecting and looking at in my own city and in my own county and in my own state, we are seeing substantially fewer deaths and hospitalizations among vaccinated people compared to people who are unvaccinated. And I'm not dogging anybody who's unvaccinated, but that is what the data are telling us. The data are telling us if you can track COVID, you will have a much lower chance of having a bad outcome if you're vaccinated than not vaccinated. And I don't want to tell people anything else because that is what the data says. And for all of the people who have died who've been vaccinated, there's been a substantially larger number of people who have died and been unvaccinated.
All right, let's keep this conversation going after the break. This actually might be the most productive conversation I've heard in all the black media on this, where we're actually having experts and people on both sides discussing these things. Because I think we all have one goal, which is to have fewer black people die from COVID-19 or from anything associated with it. And so I think having this conversation is crucial for our communities. Thank you so much. And Dr. Verholden, you mentioned that some of these questions have to be answered by, somebody who's a treating physician, not just somebody in public health, but who's in the hospitals intubating patients. And you say you had somebody you wanted us to talk to.
I did, and I really want Dr. Umar to talk to him, too, because what I appreciate is the fact that he's asking questions and challenging. I like that. We should be doing that. And I encourage people who are out here grappling. But what I do want is for what we are talking about to be grounded in fact and science. The facts, I trust our people more than I trust others. The science, that's evolving. But I'm a scientist, and so is my colleague, Dr. Adam Milam. He is an anesthesiologist. He's an M.D. Ph.D., so he's an epidemiologist, and he's also a physician. Hopkins trained, just finished a fellowship at Cleveland Clinic, one of the top hospitals in the world. He is now an attending physician at the Mayo Clinic. Since the beginning of the pandemic, he's been treating patients in the hospital. He's been looking at data. We've been publishing on it. We've got our sleeves rolled up, but he is the real deal Holyfield. And he doesn't mince words. He doesn't follow any agenda. He's about the same thing we all are, protecting and preserving the life and vitality of black people. So I just want to give my man, Dr. Adam Milam, a chance to jump in.
All right, Dr. Milam, how are you?
I'm doing well. How are you?
I'm doing great. I love being by far the least educated person on this phone right now. This is great. But Dr. Milam, I wanted you to talk a little bit to Dr. Johnson, because Dr. Johnson represents many of the questions that millions of people in our community have about the vaccine and its effectiveness and whether or not it is, is it something black people should be taking, which is a question that's in media, that is in the barbershop. Can you kind of tell us what is the current state of information we need to know on the vaccine? Is it killing old people? Is it contagious? If you take it, will you kill somebody next to you? Is it, just give us the facts so that we know.
Sure, and I would like to just start off by saying that I'm speaking on behalf of myself and none of the institutions that I'm currently employed by. But what we do know is that the COVID-19 vaccines are safe and they're effective. There's certain populations where it's not as effective for, but overall, for the general population, they are safe and they are effective at preventing severe disease. And so people who are vaccinated are less likely to have severe symptoms if they contract the virus. Most of them have mild disease, even with the new variants. And the side effects that we know about, mortality from the vaccine, death, is low, as with any other vaccines. And then the serious side effects are also low. And so just with all the other vaccines, there are some adverse side effects, but the the risk of that is very low, less than 0.1% for most of the side effects.
All right, Dr. Johnson, I want you to make any comments. Instead, I want this to be a dialogue between the doctors, and I'll sit in the corner, playing with my Game Boy and whatnot. So y'all go ahead and talk.
Well, the question that I had, good doctors, was this, and my background, so you know, is clinical psychology. That's what my doctorate is in, and also political science. I don't have a doctorate in that, but I have degrees in that. Here's where my concern is, and I would love to hear from the two of you because I would never question your expertise. Most vaccinations take years to develop, and the side effects that come from those vaccinations, we often need even more time to ascertain exactly what they are. So longitudinal data and longitudinal studies normally accompany any of the established vaccinations. However, the vaccinations for COVID, and understandably so, because it was a crisis, came rather quickly. So my concern is when we say we know that it's safe and effective, is there any long-term data to substantiate those claims, because the vaccinations have not been out long enough? So I want you guys to speak to that if you could, because that is one of the big contradictions that we have in the Black community with understanding this narrative. They have been proven safe and effective with almost no long-term data on any of them.
I think, Dr. Johnson, that's a great question. I'm going to answer a piece of it, and then I'll pass it over to my colleague. So the first thing I want to address is the speed and the velocity with which the vaccine was made. Admittedly, calling it Operation Warp Speed, I think was bad, right? You hear Warp Speed, I think Star Trek, I think cutting corners, skipping steps, all that stuff. Most of us had never heard of mRNA vaccine technology. We heard of mRNA back in high school biology class, but we hadn't heard about that or knew anything about that. But that technology had been under development for almost 2 decades. And in fact, the actual prototype of the vaccine, the sequencing and then the prototype, was led by an African-American woman who I've had multiple conversations with, Dr. Kiznethia Corbett. The difference in the time that it takes to develop a vaccine using mRNA vaccine technology versus any other vaccine technology is now that we know how to do genomic sequencing, we can make a candidate vaccine based on mRNA vaccine technology now in less than a week. In less than a week. Once you get the genetic sequence of the virus, you can pick any part of that. And we picked the mRNA, the instructions piece. And then we pulled out the instructions just to make one piece of the virus, the spike protein, which is the key that unlocks our cells. So our body could then get the instructions to make that spike protein and then build an immune response to stop the invader from being able to unlock our cells. It's transformative, and it's new right now because of COVID, but we're going to see mRNA vaccine technology more and more in vaccine development. It has cut the time down significantly. We used to have to figure out how to grow vaccines, and we couldn't figure it out because outside of the human body, so we would do things like try to grow the virus in a chicken egg and then kill off a piece of it so we would inject people. A lot of the vaccines we got as kids, they were injecting us with what's called a live attenuated virus. It was basically the virus, but some piece of it knocked out to prevent us from getting really, really sick. And some people would get sick from their vaccines. The mRNA vaccine technology is so much better than the technology that we had in the past, and it's transformative because in a week, you can develop a candidate vaccine that can be tested. The second thing that I want to speak to is this notion that we don't have longitudinal data, we don't have long-term data. That is true. The thing I want to say about that, in the lion's share of cases, there are only 2 exceptions that I can think of where it took 5 years for the negative effect of a vaccine to show up. Almost always, if there's a negative effect from a vaccine, it will show up either immediately in an adverse reaction that somebody has, or it will show up in the weeks following vaccination. That doesn't mean that there couldn't be some unknown or unintended long-term consequence, but the likelihood of that is so small. And in the meantime, people are dying. So what I ask people to consider is, if there is some small, rare, unintended negative side effect, you won't even potentially be alive to experience it if you die from the actual disease. So when I weigh that risk out for myself, to me, it was an obvious decision to make, to get vaccinated. So when we say safe and effective, that's based on everything that we know right now about vaccines and about how human beings respond to vaccines and the time frame with which typically negative adverse consequences show up. They typically don't come 5 years later. We would know within a few minutes to a few weeks.
All right, we're going to keep this conversation going after the break. This is probably the most productive. Me and Sean Garvey have already decided this is probably the best show we've done this year, the most informative show. So we're going to keep this thing going. The doctors are in the house. We literally have like every doctor across the board talking about this COVID vaccine and trying to get the proper information to the community. I will go back to you, Dr. Umar, because you really are the voice of many people in our community. You know, you go city to city, you're talking to brothers on the street corner, at the barbershop, you're listening to people during your morning calls with parents. What are some more concerns that you're hearing from parents or from people in the community about the vaccine that hopefully we can get answers to help inform people on making the most informed decision possible?
Yes, indeed. The next question would relate to the intensity of the government's campaign to get everyone vaccinated for COVID, despite the fact flu has been a problem in America for decades. It kills tens of thousands of people every year. So the reason why a lot of people are very skeptical about rushing out to get the COVID vaccination within the context of a racist American medical complex that has always used black people as research guinea pigs and involuntary lab rats to test different things on, such as the Tuskegee experiment, prison experiments, so forth and so on. Why don't we see the same intensity towards getting everyone vaccinated for the flu as we see getting everyone vaccinated for COVID, when way more people contract the flu every single year?
Okay, well, Dr. Umar, I think you got me there, because you're right on the money. But I want to correct a couple things. We saw record low numbers of flu last year, right? And the reason that is the case is because all the things we did to prevent the spread of COVID also prevent the spread of flu. So we saw record low number cases of flu, not just in the U.S., but globally, all over the entire planet. We had record low number cases of flu. It's a great point that you make. I will tell you, most people don't hear about it, but we do a lot of major flu campaigns. The difference is the mortality and the morbidity associated with the flu. So mortality, i.e. death, and morbidity, illness, long-standing, complications or things that people have to live with after they get sick, tend to be a lot lower for the flu. Little fun fact for you. That big pandemic that we had in 1918, that flu pandemic, do you know we are still living with that flu? The flu pandemic of 1918, we are still living with. And we came out of that in the absence of a vaccine. So I will grant you that. I do believe that the overemphasis and the strong government campaign and emphasis on the COVID vaccine has only fueled mistrust, has only increased people's reluctance and hesitance. And it makes sense to me. My fight is for equity. I respect people. If they've weighed out all the facts and the risk and whatever, and they're ultimately a no, I respect people's choices and decisions. My only thing is I want those choices to be based on fact, not fiction. And some of the facts, you're right, remain to be known. We don't know. So you've got to weigh that out and figure out, is the mitigation of the risk worth it for you? But flu has a substantially lower mortality rate than does COVID. Last season, we had a substantially lower flu, fewer number of cases than we did in years past because of the same protection strategies that we use. And the government is now trying to shove this down people's throats. And admittedly, when it first came out, Black and brown people had a terribly hard time getting it. When it was a scarcity model and we didn't have enough doses for everybody, there was no real effort to get it in the arms of Black people and brown people. But what we did see is people from other communities, white folks, rushing into Black and brown communities where the vaccine was being administered and jumping the line. That, to me, actually told me something. White people were rushing into our communities and jumping the line to get this thing. The problem that we have is so many things went wrong with the rollout. Now we are where we are, and now the government needs everybody to get on board so we can somewhat try to bring this thing to, I wouldn't necessarily say a logical end, because this virus is now endemic. It's endemic. We will now have to figure out and learn how to live with it. It's not going away. The approach we're taking now is not eradication, it's mitigation. We're not trying to get rid of it. We're trying to learn how to live with it and lessen the negative impact that it'll have. Dr. Marlon, what do you say?
I completely agree. So what you said, the mortality rate from influenza is a lot lower than that from COVID-19. And so I think that is the reason for the big push of this vaccine. And I want to go back to one point before the break, if I can, about people dying from the vaccine. And so the data that we do have, people are not dying from the vaccine, vaccinated people. People are dying from COVID-19. So as we stated before, vaccinated persons die at much lower rates than unvaccinated persons. And even though there are breakthrough cases in the elderly and the immunocompromised population, the risk of death is much lower when they are vaccinated. So people are not dying at alarming rates from the vaccine. It's from COVID-19.
And before we run out of time,
go ahead.
I'm going to go back to you, Dr. Umar, for your next question, but I also wanted to get your take, Dr. Umar, on vaccine mandates, and also from Dr. Mylan and Dr. Furholden, because of course that's on many people's minds because of jobs. You can't go to sporting events, you can't go to these places. Dr. Umar, what's your take on the vaccine mandates? And I want to get from the medical doctor side of what their view of it.
From a political science perspective, I take grave issue with the forcing of the vaccination, because clearly it is a violation of First Amendment rights. It is a violation of people's rights against undue searches and seizures, that people shall be secure in their homes. And of course, you know all of that being an attorney, but to me, it clearly appears to be a violation of people's individual right to do what they want to do with their person. So the forcing of it, I believe, should be prompting some sort of an argument before the U.S. Supreme Court to decide whether, in fact, the government or the government as employer can force individuals to do something with their bodies against their will. So that's the one side. The other side of it speaks to the fact that it appears the government is using Black people's reluctance to take the vaccination as a justification for discrimination. So, for example, we had at least one governor say that for those who don't want to take the vaccination, they will be replaced by immigrants. I forget if it was New York, I forget the state, but they're planning to bring in tens of thousands of immigrants to replace individuals who are not taking the vaccination. And of course, they're largely talking about us because according to the data, we are the most overrepresented group in terms of those who don't want to take the shot. And then when you look at the fact that they're denying you the right to go to school, denying you the right to go to certain jobs, to the theater, to the restaurant, to the gym, it clearly looks like Jim Crow all over again, except it's now COVID being used as the excuse versus white racism.
So, Dr. Umar, we got to have a part two to this conversation. This is the most informative conversation I think we've had without yelling, without name calling in the black community on this virus. We got to get on IG Live and do this so the people can hear this. And I think it's humongously important for us to disseminate these kinds of conversations so the folks can understand that educated black folks can agree to disagree. They can ask questions. They can get answers. And we have doctors like Dr. Mylan and Dr. Verholden who are going to give you the 100% unvarnished truth, the good, the bad, and the ugly. I think it's extremely productive for what we're trying to do in our communities as far as spreading education and health. So the doctors, are y'all down for a podcast or an IG Live on this? Just across the board?
Man, all day, every day. I would love to go back and forth and really be able to grapple with some of these things. Because guess what? People are grappling with these very same issues. So if we can have a real authentic, uncut conversation where we grapple, we don't have to agree. I would like it if we were respectful, but we don't even have to necessarily be respectful if we fighting for the same thing. If I'm fighting for my people, I'm going to punch you in the gut. I'm going for the
Dr. Verholden, we know you from Baltimore. You ain't got to be fighting people all the time.
So is Dr. Milam. So is Dr. Milam. He's from Park Heights, if y'all don't know about Baltimore. Okay?
Yeah, we got Baltimore and Philly up in here. Y'all already trying to fight people. But but before we run out of time, I did want to get just from all of your final closing statement on what you want people to understand about the vaccine and where they can get the proper information.
Okay, great. So you asked right before the break about vaccine mandates. And I want to say this. They got mandates for vaccines all over the place. You can't send your kid to school if they're not vaccinated, all of that. I want to say something else about hesitancy for vaccines in the black community. I'm telling you what the data say. You don't have to believe me. Go to the CDC website. They house all the data on vaccination. Black parents vaccinate their children at the same rate as white parents. And black adults get vaccinated at almost the same rate as white adults, slightly lower rates, mostly because we live in an unfortunate society where healthcare is linked to employment. And oftentimes, I think a little bit of difference we see in adult vaccination rates is because we have higher rates of unemployment, uninsured, and underinsured among black and brown people than we do their white counterparts. So there's no pre-existing black people are just hesitant to get vaccines. The data don't support that. With COVID specifically, and most people are surprised when I say this, I'm a public health person down in my bone marrow. Every degree I have, undergraduate and doctorate, is a public health degree. It's all I've been doing, and I am 22 years postdoc. I do know that vaccine mandates are going to move the needle. I'm personally not in favor of them right now. And the reason that I'm not is very related to what Dr. Umar talked about. I do believe that people need bodily autonomy. I do believe that this is so new. There are more questions, oftentimes, than answers that people feel like they have readily available to them. And what I don't want to do is force something on people and then mess with their mental, social, emotional, physical, spiritual well-being because something was forced on them in the wake of the way this whole thing has gone, in my opinion, has only fueled inequity. COVID exacerbated pre-existing racial disparities in health and healthcare access. And I don't want vaccine mandates to be the new tool of oppression. I think of the crack cocaine laws that came from the Anti-Drug Abuse Act. If those laws were implemented fairly, 70% of crack cocaine users were and still are to this day white. But 85% of people who were adjudicated and criminalized over crack cocaine laws were black. So I know that these vaccine mandates could potentially become a new tool of government to further marginalize black and brown people. And for that, I'm not in favor of mandates right now for the COVID vaccine. And also because there is so much confusion and unanswered questions, I think we as a society, the government, public health, and medicine have to do a better job at resolving concerns before we start to force shots in arms. Fuck, my phone died.
All right, Dr. Mylan.
Oh,
no, we're still here, Dr. Verholden. All right, Dr. Mylan, you there?
I got fired up.
Wow,
all right,
okay.
All right, Dr. Mylan, go ahead.
Yeah, so I'm glad I'm a part of this conversation. I've had similar conversations with my family about the vaccine. A lot of them, were opposed to the vaccine. What I'll tell them and what I'll tell the audience is people should question everything, but seek out information and make an informed decision based on that information. What we know so far is the data shows that the vaccines are safe and they help prevent severe illness, which is especially important in our community where there's so many comorbidities and high prevalence of, diabetes and heart disease for a lot of reasons that Dr. Verholden and Dr. Johnson have mentioned around social determinants of health and inequities. So I think it's especially important for our community to get the vaccines. And we know that so far that it's safe. As mentioned earlier, the side effects that you see from vaccines are usually seen within 6 weeks. And we've had 400 million people vaccinated and a low incidence of any kind of adverse effects. So I'm happy that we are having this conversation, and I hope we can continue this conversation so that our community is informed.
All right, final statement to you, Dr. Johnson.
Yes, indeed. I would say it was a great conversation, and I was honored to be able to communicate with the two doctors there. I would say that because we live in a country and a society that is dominated by the profit motive, we have to look at how capitalist influence is playing a role. When we look at the Pfizer vaccination and the Moderna vaccination, they reported profits in excess of $3 billion last year. Both companies project to make nearly $20 billion in 2021 alone by administering these vaccinations. They're charging on average $30 per person for the 2 doses in America and $36 per person for the 2 doses in the UK. And they are making filthy rich profits for themselves and their investors. Understanding that the FDA has long been questioned for being influenced by drug company profits, we have to question the conclusions that come to us from the FDA, since it is not illegal for officials of the FDA to have personal stock investments in the very same companies they are supposed to police. So that is just my offering to that. But I am very, very proud and very, very honored to have spent this time with the two doctors.
All right, and the book. How can people buy the book, that big, thick book?
Oh, yes, sir. Black Parent Advocate, The Art of War for Dealing with America's Public and Charter Schools. They can order the book at DrUmarJohnson.com.
All right, thank you so much, Dr. Umar Johnson. We're going to schedule a Instagram Live for this. We're going to have this conversation on a podcast, unfiltered. Dr. Verholden is from Baltimore, so she can cuss all she wants on it. It's going to be great. So we'll let you guys know when we put those things together. Got to thank Dr. Deborah Verholden, Chief Epidemiologist, Michigan State University, Dr. Milan, anesthesiologist, Johns Hopkins University, Dr. Umar Johnson, the Prince of Pan-Africanism himself,